So my name is Dr. Romero, and I'm a psychotherapist. And I've been here, this is my first time doing a mission ever. And this is the first time that IMA has a psychotherapist on staff. So it's been a lot of learn as I go and improvise with what's available in terms of the space and things like that. And we've just made it work. Every patient that walks in has a psychological need of some sort, especially because psychological care is so inaccessible here from what I've learned from the patients. So a lot of them don't even know that they need it, right? So I've had to do a lot of advocacy work with the doctors and some of the triage nurses to help get the word out. But once it's gotten out, I mean, every patient that comes in is, in need. So the managing of the volume has been a little bit overwhelming. I'm used to seeing, well under 8 to 10 patients a day back in my practice. And here, that can happen in an hour, if we really let it get there. So now I have volunteers, 3 psych volunteers that also see patients. So we've had to divvy up our space to create more room, which is a good problem to have. So I just feel so much more energized now that I have that support, because the type of cases we've seen are the most severe type of work that we can do as psychotherapists, which involves a lot of trauma, a lot of abuse, domestic violence, a lot of specific abuse against women, sexual abuse, and also severe trauma like work accidents. We have an amazing prosthetics team here, so that attracts a lot of folks who have gone through tragic work accidents, sadly very preventable accidents, if there were more regulations and things like that. So we see arms that have been blown off, arms and legs that have been blown off. And these are young men that are starting their life, supporting a new family, or maybe they haven't even had children yet, and they're kind of hopeless. So my job and the job of my team is to draw from them what their hopes are for their future, and to help them not just put words to it, but also be very specific about what they want it to look like, so that they have a very clear vision for what they're working towards, what they're working for. And our sessions stand alone. We're not going to see them in 2 weeks or in 6 months. So the beginning and the ending of the session stands on its own, and that little seed of hope that we plant, we have a lot of hope that it will grow into something much more for these patients. And the amount of resilience that I've seen is just mind-blowing, honestly. I'm forever changed from seeing how these men, women, children just are still happy and grateful. And a lot of them have said, especially the ones that have like missing limbs and things like that, they've said, I thought I was going to be depressed the first couple nights that I realized I, was no longer going to have an arm or a leg. And I'm surprised to see I haven't been depressed. I have a strong faith, I have my family, and so I really just want to have an arm for practical reasons. I want to be able to, brush my teeth in the morning. So, I picture myself being completely depressed for the rest of my life if I was to have a missing limb or something like that. So that's just a very tip of the iceberg of the amount of trauma and violence that I have worked with and my team has worked with. So I have one other particular story of a woman, her husband and her 2 girls. They traveled to the United States in hopes of a better life. Unfortunately, they were deported. They didn't have documentation, so they were deported. And in the jails that they encountered in northern parts of Mexico, they had some criminal behavior where folks would board the buses and collect payment from the migrants. If you ran out of payment, they witnessed a man being decapitated on the bus. And these are 2 little girls, a mom and a dad. There was some sexual trauma for the little girls in front of the family members. So they had never talked about this before with anybody. This happened in February. We're in the beginnings of August. So of course I talked to the mom, and then I go and ask the girls to come in, and we have individual sessions with each one, and we have a session with the family, and we talk about trauma and how it works in the body, and some resources that are available to help us kind of integrate these experiences and make sense of it, really, because the PTSD symptoms are there, the nightmares, the triggers. In fact, the mom was having a bit of a panic attack in the clinic because she saw someone of Mexican descent, one of the doctors. So that was a trigger for her. She started panicking. So I went in, they referred her to me, and it turns out she has this incredibly traumatic experience just because she wanted a better life for her family. You know, it's really what drives these families, is they're just wanting to eat and have a job and, you know, be able to get dressed in the morning. It's been very inspiring to be able to kind of mark their life in some way. And I'm taking these experiences back with me, and I feel like I'm so filled with hope for my patients back home and for just my own family, of seeing what's possible when we can relate to people who have a completely different level of access to care. Yeah, I'm filled with a lot of grief, but a lot of hope at the same time. So I'm excited to come back with more therapists and possibly more little offices like this, and to be able to have help even more people. So, all right.